This is Kevin Hardy from HardyGroup. It's my pleasure today to speak with Mark McNamara, the Executive Director of Pathology in the South Australian Health System. Mark has extensive experience in working in large, complex public and private sector organisations, strengthening financial performance and enhancing financial decision-making. What I like about Mark's approach is that he also connects this decision-making and planning with the organisation's strategic and business plans, culture building, change management plans, and performance management systems so that they get a better result. So, on that note, let's begin. Mark, systems always look to improve, and financial leadership is critical in the public sector environment as it is everywhere. And what are the key principal leadership challenges and opportunities in the current environment that we exist in?
Yeah, sure. Look, I agree. There are significant financial challenges and opportunities. It's partly why I came across into the public sector, because I think there is, in a number of areas, some skill deficiencies and sort of process gaps against best practice. So, I mean, from my observation, I've now led the TAFE in Melbourne and the pathology business in South Australia. I think using those two as examples, I think the gaps that I've seen are around the whole end-to-end process, strat planning, annual business planning, alignment of that plan through the organisation and execution and governance across that. So I've seen that end-to-end process not operating well in both of the organisations that I've gone into over the last 5 years. I think there's a imperative around engaging across the business, but agreeing what the priorities are and by default what they're not. You get a lot of different requests from a lot of different stakeholders, and I think there's a challenge is around not biting off too many things, rather trying to focus in on what the right things are to do and to do the right things well. I found just in terms of leadership, I found generally that the public sector in the two organisations I've gone into is probably undervalued and under-invested in both leadership and general management. So those are definitely areas that, from my perspective, need to be invested in, using that as a barometer for the rest of the public sector. I think extending that more, I've got a lot of benefit out of pulling together the 100 leaders in my business, those which manage a large number of people, and just simply getting them together every couple of months and working through our plan and getting that engagement surprisingly hasn't happened in my organisation for many years. And I think then not being embarrassed or unprepared to drive efficiencies, to produce surpluses, to be able to reinvest in areas that deliver a public good. For example, reinvesting in research, reinvesting in areas of your strategic plan that need additional skills or additional equipment or what have you, and not necessarily having to go to the government with your hand out all of the time to do that, but to be able to, produce surpluses yourself to be able to do that. So, look, I think that's a few of the things. There's a whole lot of sub-issues under each of those, but at a high level, they're probably the comments I'd make about financial challenges and opportunities.
Okay, perfect. Thank you. And in terms of how financial leadership can contribute to producing a healthcare social dividend, which you had mentioned before in an earlier conversation, what are your thoughts on that?
Yeah, look, I think it's one of the things that attracts me to the public sector. I've ended up being in two state public sector entities that have at least parts of them that compete with the private sector. So, I think to be able to benchmark and be as efficient as, or at least that have as a goal to be as efficient as private sector operations, but instead of then producing a profit to shareholders, being able to produce a surplus, as I said, for reinvestment in areas that advance the public good. So think areas like training, areas like research. We do a lot of applied research. We do a lot of pilot work in areas of addressing at-risk cohorts in combination with the private sector or general practitioner sector, which is ultimately aimed at keeping people out of hospital and keeping people healthy. So these are things that the private sector would rarely think about doing, but if you can run efficiently and run well and produce surpluses, then you can make a bigger contribution to the broader system, and that's really what guides and drives me in a lot of instances.
Yeah, and it's there are different ways to define profit. So the things that you've
Correct.
talked about, it's profitable. Yeah, that's correct.
Yeah.
I mean, 2019, you said that you wouldn't mind sitting down at lunch to talk about leadership with John Howard. What were your thoughts?
Look, I said that. I think, why is that the case? I think he was a leader, firstly, that was prepared to do the right things, not the easy things. So he did and led a number of things that were perhaps unpopular, but through strength of conviction, strength of argument, drove policy reform in areas like gun control, social areas, but also things like GST. I mean, he was upfront with taking the GST consumption tax to the electorate through a election process and won a mandate for that. In terms of, I think he was an understated, unassuming sort of a guy. I think he was really a guy who was of the people. I also think he was a very quite a values-driven leader. I mean, for me, he came across with a lot of integrity. He was genuine. He was a sort of family guy, a caring guy. And I think, whilst people might have disagreed with his policies, I think a large number of the electorate understood and aligned with his values and principles. Mm-hmm. There are a few other things. I think he was consultative as best he could when he had the luxury of time. I think he just had a balance of strengths and capabilities that made him stood out as an effective leader, and I guess the electorate recognised that by giving him, I think it was 4 terms.
Mm-hmm. Yeah. Okay. Thank you. And in terms of what the public sector still has to learn from the private sector in terms of high quality financial leadership and management, do you have any thoughts about that?
Yeah, I do. I think there's a lot, and I mean, as you're aware, most of my career is across 4 ASX 50 companies and the last 5 years in the public sector. I think there are a number of there's a number of things that the private sector generally does better that can be learnings, but I think the opposite is true as well. I think in the area of skill and capability sort of gaps and deficiencies, I think that whole issue of planning and executing across large complex businesses, I think it's generally done significantly better in the private sector, at least in my observation. I think I mentioned the value of strong leadership and management skills, and that perhaps they're more valued and recognised in the private sector. In some instances, I'm not sure the public sector even really knows what good looks like in that space. I think the private sector, being driven around quality and profitability, often has basic structures that deliver accountability, which often the public system doesn't have. I mean, I've experienced decisions being made at all sorts of levels in all sorts of places that are a long way away from the people who have got to implement them. And then you have this, who's really responsible for this? I think models to support decision making. I think generally, not just financially, but in other areas. I think that's certainly in the big companies that I've worked for. They're pretty robust compared to some of the equivalents I've seen in the public sector. I think performance management models, not just at all levels, being individual levels right through to sort of profit cells and operational cells of organisations. I think models for improving culture and areas around reward and recognition and areas around change management. I've come into a number of roles now where I've been asked to lead reform and transformation. It's often the case that I get in there and after a few months, I'm not sure the organisation that's appointed me even really clearly understands what they're asking for. But I just touch on the other side though. What are the skills perhaps that are uniquely required for in the public sector? And once again, just in my experience, I think the relative importance of stakeholder management and alignment. I find you can get a lot done in the public sector, but it's relatively important to engage across a broader range of stakeholders because people can even say they're on board, but when you test and challenge that for understanding, it's not always the case. So, so I think a takeaway for me, as I said, is when you're asked to do something of significance, to test and challenge to make sure that the implications of that request are clearly understood and that those parties are up for the implications of that before you start. So I think, I think that's a handful of the, I guess, the compare and contrast that I'd offer.
Okay, that's excellent. Thank you so much. And it's interesting, it's in the public sector in the past, there have quite often been almost perverse incentives because if you made a profit, then you quite often just lost it. So
correct. That's mad. And I've had discussions with the Treasury down here about that. That is just crazy. And I'm getting a bit of, some people, the Health and Treasury are starting to sit back and understand that, there's nothing, you don't need to apologise for producing a surplus, but I don't want it taken off me because I've said to them that I want to reinvest it. I've got a strat plan that's got 47 initiatives and I don't want to have to go to the government for permission or for money to implement any of those. I want to self-fund.
Mark, it's been a pleasure speaking with you today. I thank you very, very much. And I look forward to talking to you again about some of the issues that we raised. Thank you.